A bill that supporters claim would give the Government Oversight Committee the proper tools by allowing access to case files related to the Department of Health and Human Services was discussed today. The proposal requires the director of OPEGA to present biennial briefings to the GOC on confidentiality policies when conducting program evaluations. Also asking for them to share the confidential draft of a program evaluation report before public release. At a press conference today, supporters pointed towards deaths of children in the custody of DHHS and the Office of Child and Family Services. A bipartisan group spoke saying that accountability is needed now and say there are challenges with the current structure.
I want every tool possible in our toolbox to do the investigatory work that's necessary to make sure that Augusta is not broken like Washington is broken.
We personally have dealt with DHHS, and I'm going to tell you, it's a mess. We can't find good foster parents because, the system is so broken that people that want to do this, they don't want to deal with that system.
Speakers say despite bipartisan support, Democratic leadership has left the proposal in limbo. A Senate vote this morning advanced the bill but adjourned before a House vote, effectively killing the bill. We reached out to DHHS and have not yet heard back.